Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and I'm maternal newborn nursing certified. Cosmetic procedures can be a wonderful form of self-care for many people, but women often wonder if these procedures are safe during pregnancy and while breastfeeding. Today is part 2 of our series where we'll be giving you the scoop on some of the most common cosmetic procedures and whether you should consider them safe while you are pregnant or breastfeeding. So click those like and subscribe buttons and stay with us. Teeth whitening is a common cosmetic procedure that women will seek out. So with teeth whitening, there's no data or studies or consistent advice from dentists or OBs to tell us whether this is safe. Hydrogen peroxide is the most common active ingredient for both professional teeth whitening and over-the-counter products. Once hydrogen peroxide is in contact with your teeth, it breaks down into water and gas, which is considered harmless. But most professionals say to wait until after delivery and breastfeeding is over in order to be safe. No matter what, do not get your teeth whitened with a beauty salon or other cosmetic facility. Instead, only use a dental office for this procedure while pregnant or breastfeeding. Many women want to get a tattoo, but getting a tattoo during pregnancy does pose some risks. Infection is the biggest risk that we are worried about, specifically developing hepatitis B, hepatitis C, or HIV. If you're going to get a tattoo, you want to make sure you go to a parlor that has a registered practitioner with your state. You want to make sure that you see them using gloves, sterile technique, new needles, and that they have something called an autoclave, which sterilizes their equipment on site. Now, that being said, you may not want to get that tattoo until after birth, because due to skin changes, the tattoo may actually look different once you give birth. We recommend that you wait 9 to 12 months post-birth and or post-weaning before you get any tattoos, because additionally, the ink does enter your system and it can take months to years to break down. Some of these inks may also contain heavy metals, which may be toxic to your baby. Tattoo removal, which is usually done by laser, is contraindicated during pregnancy and breastfeeding, so you'll need to wait for that. Also, many women like to get piercings while they are pregnant or breastfeeding. Piercings in general are okay as long as you're going to a reputable facility because, again, our biggest risk is infection. However, nipple piercings are contraindicated. Now, most people may think it's for breastfeeding reasons, but that's actually not it. During pregnancy and postpartum, the hormones that encourage milk production significantly affect breast tissue. They also affect nipple tissue. And due to these hormonal changes, you may have adverse cosmetic effects postpartum once those hormones go back to normal related to your nipple piercing. Many people enjoy getting eyelash extensions to make their eyes look pretty. And most people might think that it's actually safe, but there are some risks with this procedure. For starters, you have to lie on your back for extended periods of time. And lying on your back after 20 weeks of pregnancy is not advisable. You want to find out if they can incline, kind of raise up the lash bed. Also ask for a pillow to be used underneath your feet, and you need to take breaks during the application process. The lash glue does contain chemicals and there is an aroma, and we're not sure about the risks. There's no real data about it, so make sure you're in a well-ventilated room. Ask for them to use a lash fan to help move the fumes away from your face and then to seal the lashes with a sealant after you're done. Finally, we don't know a lot about the lash glue and whether it can enter into your breast milk. So these serums should be avoided for both pregnancy and breastfeeding. You may find some over-the-counter lash boosters to help grow your eyelashes. There's no data on these either, and you should avoid them. Please remember to hit the like and subscribe button so you can get our latest content. Dyeing our hair is a very common thing, but we don't know if that's safe or not for breastfeeding and pregnancy. The research shows most of the hair dye is safe, but it does absorb through the skin. And what we do know is if massive amounts of the hair dye were to enter your system, it would be dangerous to your baby. So the recommendation is to wait until you're at least 12 weeks along before you start using hair dye. You want to make sure that you're using gloves to protect your skin and leave the hair dye on for the shortest time possible. Highlighting your hair only dyes the hair. It does not actually touch the scalp, which means it does not get into your bloodstream. Semi-permanent dyes like vegetable dyes and henna are safer to use. But you should be aware pregnancy hormones can cause the dyes to behave differently with your hair than you are normally used to. Finally, there's very little data on breastfeeding and therefore we don't recommend it while you are breastfeeding. Manicures and pedicures are one of the most popular cosmetic procedures out there. As far as they go, they are okay within reason. But let's start with some of the chemicals that are used. Nail polish, believe it or not, can be harmful because many of them contain formaldehyde, which has been linked to miscarriage and cancer. So try to look for one that doesn't have formaldehyde. Many of them also have phthalates, which may cause endocrine issues. The endocrine system is your hormonal system, and of course hormones are very important for pregnancy and postpartum. Acrylic nails also have chemicals, but these chemicals are actually not harmful. However, the aroma, the smell that they emit is no good. You also want to look for infection risk. So you want to make sure that you're going to a salon that is certified and clean. Many of the salons will use something called acetone. Acetone is the chemical that is used to help remove nail polish. Acetone is harmful and it does absorb through your skin. So you want to make sure you're able to wash your hands or your feet immediately after they have used it. And it is questionable whether you can use acetone while you're breastfeeding. Pedicures are also safe, but again, infection is the biggest risk, so you want to make sure the facility is clean. Now, finally, you may find that some of these salons will offer something called a pregnancy pedicure. This is actually a pedicure designed to help your swollen feet, and this can actually be really beneficial and really soothing. I hope this video has helped you learn all about the common cosmetic procedures you may consider having and whether you should get them while you're pregnant or breastfeeding. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.